Hello everyone, my name is Lathifah Kartika Defi. I'm from Duta Bangsa University. Here I would like to tell about duties and authorities of medical recorder in the release of medical information for COVID-19 patients. Do you know guys what is medical record? Medical record is a file containing notes and documents about the patient identity, examination results, treatment that has been given, as well as action and other services that have been provided to patients at healthcare facilities. There are 6 uses of medical record, which we can call Alfred. What is Alfred? Alfred is administration, legal, financial, research, education, and documentation. Meanwhile, the main purpose of medical record is to accurately and completely document about the patient life and health history, past and present illness, and treatment by emphasizing events that affect the patient during the treatment period and to support the achievement of orderly administration in the context of effort to improve hospital services. Because without the support of a good and correct medical record management, the orderly administration of hospital will not work as expected. Then who is in charge of this field? It's medical recorder, who has the responsibility to maintain and save the patient medical record file. A medical recorder is a person who passes the medical record and health information education in accordance with the provision of legislation. The activity of maintaining, storing, and serving medical record, both manually and electronically, to presenting health information in hospital, clinic, health insurance, healthcare facilities, and other who provide service. And the maintained record is the management of medical record and health information services. Healthcare facilities are obligated to maintain the confidentiality of the information contained in the medical record file and are not allowed to release it to irresponsible people or institutions. Meanwhile, the contents of the medical record file are the condition of the patient. Therefore, the medical record file can be released with the consent of patients or their family. Procedure release of medical record information must be accompanied by written consent from the patients as the owner of the information in record medical, as well as content presentation medical record must be a treating doctor of the patient. In the current stage of the COVID-19 pandemic, medical records are very useful for research, education, and financial reporting. The release and borrowing of patient medical information are also strictly controlled and kept confidential. There is some duties and authorities of medical recorder in the release of medical information for COVID-19 patients are as follows. 1. Serving requires and making medical certificate. 2. Search patient medical record file. 3. Making the patient's medical data, then asking for signature of the doctor who treat and examine the patients. 4. Requesting a signature from the head of the administrative divisions for the purpose of visum et repertum. 5. Requesting the hospital director's signature for an introduction to visum et repertum. 6. Keeping record of the release of patients' medical information to third parties. And last, make internal and external hospital report and fulfill service for medical data needs in their release. Medical recorder can release patient medical information to third parties without proper procedure because medical record document is very confidential. Especially in the current COVID-19 pandemic, the leakage of medical information is very sensitive. There are some Indonesian people who think that COVID-19 is an embarrassing disease like a sin. They don't want people around them to know and worry if people will stay away from them. Leaking medical information of COVID-19 patients will also make patients and their families experience mental and social stress. Basically, every patient has the right to privacy and confidentiality of the illness they suffer, including their medical data. This is regulated in Article 32, letter A of Law Number 44, 2009, concerning hospital. So, if the medical recorder doesn't protect the identity of the patient who is positive for COVID-19, then the medical recorder will get criminal law, such revocation of possession or pay a fine of 50 million rupiah. Therefore, to avoid this from happening but also to maintain patient privacy, the medical recorder should to provide medical information about the patient history using initial, not with the name patient directly. Medical recorder must keep their oath of promise not to divulge patient medical information to people who have not their business with the patients. I think it's enough from me, guys. I hope you understand what I say and enjoy with my video. Don't forget to like this video and thank you so much for watching. See you next time. Bye bye.